Pharma Pharmaceutical Consultants and ProData Analytics. I'm delighted once again to have a chance to talk to you. I want to talk to you today about something that as a data person I find troubling, and that is the language that's being used and the difficulties that people are having with different data analytics. And I want to try and put this in perspective. I'm not taking a political position or otherwise. I want to talk about the rhetoric and what people are using because it is disturbing. The first thing when we talk about data is that in fact data is not the issue. Data in general is a collection of information. Clearly words that are being used with regard to fake and false and alternative facts are all just nonsense. The real issue with data is that you collect information for whatever particular purpose, and all of this is done within the confines of what science uses, and science is really based not on answers but on questions. The question that you ask drives what kind of data you collect. So for example, if you're a manufacturer, you may collect data in order to support your case that a particular drug or device is of benefit. Clearly issues with regard to what's going on in even a larger perspective in climate outside of healthcare, etc., are in question. But you collect this information, and then whatever the information and how it was collected, and hopefully it was collected in a reasonable way. If it wasn't and it was people were making up information, then that's just lying. It's just information where people aren't just being honest. But given that people are telling the truth, and the vast majority of information that we look at and others look at is not done in a way that is being fake or is being in a way that somebody is lying about it. There may be questions and issues with regard to whether that data is valuable, whether there are questions as to whether people thought about all of the right limitations, etc. But at the end of the day, you're dealing with information that was collected in a reasonable way in order to try and address a particular question. Now, we live in a world where there is a great deal of commercialism, and people have data and they publicize that data in order to try and demonstrate that their drug or device or whatever is a useful product, is something that people can use and that they can get benefit from. And there's nothing wrong with that. It is for us to understand that we then scrutinize, and depending on how we are, we may ask further questions as to, is that the only option? Did you consider all the limitations? Are we using statistics or data in order to try and manipulate the situation? But in general, people are honest about it, are trying to give an honest response. And if it turns out later that they're wrong or that there are some changes, that's just the nature of science. People question these things all the time. And the idea that people are looking at the world and are identifying that things don't meet their particular limitations or doesn't agree with their worldview is the nature of things. It happens. It's a natural progression of what goes on. Science progresses because people ask these questions, and there may be a argument at one time and then it may be overthrown at another time, and that's just the nature of what goes on. It's not about anything where people are lying about data or otherwise. It's just the natural course of looking at things and addressing it. So we want to deal with the data collection issue and ask, what was the question that was being asked? In science and statistics, we call that the null hypothesis. But without getting overly technical here, we're trying to address what is the information, how is it being collected, and what was the question that was being used? Why were we collecting data at all? And then the real key issue here is the analytics. What do you do with that information and how is it being evaluated? When you evaluate something, it's terribly important that you identify what was the original question, why were you asking this, what was the information that you were trying to address, and then two, what was the method? What kind of a method did you use? Did you do a method that is well established and people have used it, evaluated it, verified the methodology, Or is it a totally new methodology that no one has verified? And it's important that you say that so that people can look at it and say, well, maybe this is an important new way of looking at it. Or now we have to look at the results even more carefully because it doesn't fit with the standard way of looking at things. And so as a result of that, it's not that it's bad, it's not that it's good or otherwise. It's not a good, bad kind of question. It's more along the lines of, do we have the information that we need in order to try and judge it? And judging it is up to the different stakeholders and people who are for it, against it, and otherwise as to what they do. When we're questioning, the next step after the methodology is to give a very honest review of the limitations of whatever has been done. And so when you talk about, I for example, was looking at data, and let's just say, for example, that I was looking to see whether obesity has some link to colon cancer. Well, that's the first question. Is there a link? And clearly I'm going to look at that. What kind of methodology am I going to do? I'm going to be collecting patients that are obese. I'm going to be collecting those to see if there is a rate of colon cancer or not. Clearly there has to be a size limitation because I need to have a particular size of the population in order to make sure that I'm seeing whatever the problems are. And then I want to, after I deal with the methodology and the results, whatever they are, I also want to deal with the limitations. The limitations look at it and say, what kind of things limited my results? And just as importantly, what kind of confounding variables? What is confounding variable? A confounding variable means that there's some other reason where the results could have occurred, and they discuss it and they identify it in that regard. So there is a give and take in what goes on, and then questioning that goes on later. Well, what kind of things are we seeing? And people are talking about fake data, people don't believe in this or that or otherwise. Those are the wrong questions, and there's certainly issues where people are either immature or illiterate with regard to what goes on in medicine or science in all of this respect. Clearly there's groups today that are trying to hold on to data that has been done so that there cannot be groups that for their own purposes are trying to delete that data and take it away. But the larger question is that when we collect data, one reason is that we're trying to see if there's a relationship. So fine. A second reason is that we pick data, and then in looking at it, in the analysis of it, we see that perhaps there's an association. That association may be real or it may not be. Certainly a lot of things that are published today and a lot of things that are spoken about are associations rather than something that we know conclusively. Because once you have an association, the next step is to go study it to make sure that it is association to causation and it's not just something that is out. I don't want to make this too complicated, but I do want to address the fact that in looking at data, and certainly as a data person, and a person who deals with analytics and has done so for a long time, that one has to look at this entire system and say, what did I do it for, and what was the methodology, and what were the results? And then when people are arguing, well, this doesn't fit with what I want, etc., then people can come to some conclusion that, well, you're just being a factionalist and you want to prove that your point is right, and if the data doesn't work, then you're already talking about it. We're certainly seeing that in politics today. It's also winding itself down in studies that are being done by nonpartisan groups in politics. But the thing that's really concerning here is that the language of these people is busy filtering down to science, it's busy filtering down to analytics, and as a result of that, we are all harmed when people don't understand or they're using it for their own purposes or making up these ridiculous terms with regard to alternative facts and fake information, false information, etc. If people are really doing that, they're just lying. Our job is not so much that, because that's a very, very small piece of what goes on. It's a very small piece. What we really want to deal with is, what is the information? How do we pay attention to it? How do we know about the methodology? Have they talked about what the limitations are? And then have an honest and respectful conversation about what goes on. I think that you'll find that in doing so, you come to a much more reasonable discussion of what happens. Isaac Asimov, one of the great physicists of the last century, said that your lack of understanding is not equal to my understanding. And it was a way of trying to separate the two, to identify that we need to come to some common ground where people are actually having a rational discussion about these things versus using all of this information in ways that filters over and that we're all having to address. I hope that this has been useful. As always, we're interested to hear your comments and results. We'd like you to like, subscribe, and share if you like what we're talking about. We'd also like for you to go to www.propharmaconsultants.com /RxInfoX for daily news of what goes on. And we're just adding a lot of the commentaries and news that's happening in major journals so that people can have even more information in what they're seeing. I look forward to seeing you again next week. I hope you have a wonderful week, and thanks for taking time to talk to us.